All right, all right, you're all set. Perfect.
Let me know when you can see the screen.
I can see the screen.
Lovely. Okay, start then. Hi, everyone. My name is Yoobin. I'm the CEO and co-founder at Quip Medical, and we're bringing the joy of medicine back to physicians. I distinctly remember the day I became disillusioned with the field of medicine. It was my first day in clinic as a first-year medical student, and I thought, today's the day I get to talk to real patients. Today's the day I get to learn how to be a doctor. And instead, I learned how to write notes. The unfortunate reality of today is that physicians waste 50 hours per month on unpaid paperwork. Now, some physicians may choose to take that time back to themselves for their own mental health, and others may want to see more patients, but nobody wants to spend that additional time on paperwork. Should physicians choose to fill that time with more work, that is a lost opportunity of 150 additional patient consults. And to put things into perspective, that's about $9,000 worth of a physician's time spent on something you do not need a medical degree for. And we want to fix that. Quip Medical has built the first true end-to-end clinical documentation ecosystem by using patient encounter notes to automatically suggest all the relevant billing codes and maximize physicians' profitability. We started by tackling the biggest problem of paperwork with our AI scribe, but realized that there was something missing. So we started building out features for post-consult work. Still, there were evident shortcomings of these AI scribes on the market. And that's when we dove deep into insurance and medical billing, a promising market with proven products that have set exciting precedents with acquisitions from large organizations like RBCX. Here, we could see the gap, the opportunity for Quip to tackle all components of the current workflow. See, existing solutions have tried to automate the note-taking or post-consult referral generation, and some have automated both, such as Mutual Health, Tally, and Scribeberry, to name a few. If you work in the health tech sector, maybe you've heard of billing support from platforms such as Dr. Bill or Dr. Care. At Quip, we've built all three. Not only do we follow the standard PIPEDA and PHIPAA regulations and provide end-to-end encryption of patient data, but unlike our competitors, we go the extra mile by de-identifying patient transcripts prior to the processing of the summary note. Furthermore, our aforementioned billing feature ensures that codes are limited to the context of the conversation and ensures that doctors aren't missing out on money that they should be getting paid. We're not just here to save physicians time, we're also here to save them money. To begin using Quip, doctors simply press the mic at the center of the screen to start a recording. From there, doctors can take the time to look at the patient and genuinely listen to the concerns without worrying about documenting the consultation simultaneously. At the end of the assessment, the generated summary note is automatically synced to our web app, from which physicians can seamlessly copy the note into their respective electronic medical records with one click. The best part, from our web app, physicians then have the option to retrieve all the relevant OHIP billing codes based on the scope of the assessment. At the end of the day, patients are happier, notes are more precise, and doctors are fully compensated for their care. Our users are already seeing the benefits. Family doctors, nurse practitioners, and so many others have told us that they simply cannot go back to the way things were. The canceled dinner plans, missed goodnights to kids, poor patient rapport, all now prevented with the use of Quip. We currently have 30 beta users on our MVP platform across both Canada and the US, with zero churn thus far. In addition, we've recently partnered with the Department of Family Medicine at the University of Ottawa to pilot our technology. And this partnership alone allows us to service a potential pipeline of over 100 affiliated providers across the city. To date, we've generated more than 4,000 notes across 5 clinics, demonstrating a total time saving of more than 400 hours. Despite our rapidly growing user base, we've been able to maintain a low unit cost of less than $2 per user, priming us well to scale in the near future. We currently offer 2 business models, depending on the consumer profile. For individual physicians or small clinics, we offer a monthly subscription model, while larger family health organizations or hospitals contact us for a custom enterprise deal to negotiate annual licenses. From each of these models, we currently have an MRR of $2,000 with $50,000 more in ARR currently in the sales cycle with academic hospitals, making our projected MRR $6,000 by the end of 2024. See, with 6.5 million total potential users, encompassing physicians, nurse practitioners, physiotherapists, and other allied health professionals across North America, we are currently targeting a $7 billion serviceable attainable market with avenues to eventually target a $21 billion market globally in the near future, based on these two business models. So following the integration of direct claim submissions for billing, we plan to transition off of the subscription model and instead pivot to a commission model. So in doing so, this would not only lower adoption friction, as we would be taking a commission of what doctors are billing directly to the Ministry of Health, but it would also increase revenue potential by threefold per user. So with this adjustment, our previous TAM of $21 billion turns into a $60.6 billion opportunity despite the same number of total users. To date, we've incorporated an AI scribe and optimized billing suggestions into Quip's ecosystem. In addition, we've partnered with UOttawa's Faculty of Medicine to launch pilots, quality improvement studies, develop a French integration, and provide adaptations for use in affiliated retirement homes. To support this, we've already begun integrations with Point Quick Care, the #1 EMR for long-term care homes. Yes, we've already built billing suggestions, but we're preparing for something greater. Looking forward, we plan to integrate a partner with select EMR platforms to provide easier workflows for users as well as other direct claim submissions to the Ministry of Health, thus allowing us to pivot to our aforementioned commission model. Interestingly, as of 2024, pharmacists can now treat 14 minor ailments without the supervision of physicians. And there are plans to actually add an additional 19 minor ailments under the jurisdiction of pharmacists, likely increasing not only patient influx, but also the associated administrative burdens to the pharmacists. So we plan to take advantage of this opportune timing to target not only the primary care physicians, but also pharmacists over the next few months and leverage the existing network of retail pharmacies for distribution channels. We've already validated that we can build and sell Quip as is with its core functionality. But with your support, we can expand Quip's ecosystem with these features in the pipeline and expedite our market share in sectors listed here on the screen. Now, none of this would have been possible without our amazing team of engineers, all graduates from the University of Waterloo. Our CTO has years of experience and publications in AI research and brings his expertise working in the fintech sector. We are a deeply technical team with firsthand experience in the medical field, allowing us to leverage personal connections across the region. I think we can all assume that doctors like talking to patients, or at least most of them do. And if you're a family doctor, you like asking them about how their vacation was, how their kids are doing, or in my preceptor's case, he likes asking about golfing. But as administrative burdens have continued to rise, the luxury of small talk has turned into a luxury that can no longer be afforded. I understand why documentation is so important. In fact, I believe it is essential to quality patient care. But with this technology we have available today, why are physicians still forced to remain glued to their monitors when they so desperately want to look at you, the patient, instead? I didn't go to medical school to write notes all day. I came to help and connect with people. And I can assure you that doctors feel the exact same way. Thank you.
Great. Thanks, Yoobin. All right. So you came in at just under 10 minutes. So excellent work. All right. Question time. So let's start with you, Michelle.
Awesome. Nice job, Yoobin. It was cool seeing it. I saw it a couple weeks ago, and then to see kind of the progression 2 weeks later. Some of the things that I think were a lot more clear this time around is the value prop. I know something we talked about last time is, is the value prop time, or is the value prop like money saved? So like I liked how at first
Mhm.
you were like it could be either depending on what the doctor's looking for. I think
Mhm.
you talked about the amount of extra revenue that could be generated with the time. Maybe even just say like,
Mhm.
I don't know if there's a study that shows like how many doctors would choose the time over the money, but maybe just some like
Mm.
quantifiable stat to like show the value prop of the time as well as the money, as opposed to just like hours saved, like X amount of clinicians would
Mhm.
choose that time. Just an idea there.
Mhm.
The
Mhm.
competitor slide, I thought you did a good job explaining the differences, but I think it'd be nice to visually show the differences in a chart of some kind, like green check marks for all the things that your company's doing versus other ones. And I think from the investor's perspective, oftentimes you'll like circulate these decks after you do the pitch. And it's good
Mhm.
memory when we're flipping back through to be like, oh yeah, they were talking about these things versus just only showing that kind of crossover section. I think that's like a helpful takeaway. Really like the traction slide. I think that was like a really good addition. I was a little confused on like why you wouldn't start with the tiered like take rate model. Like why are you starting with a
Mhm.
subscription and then like transitioning over?
So the commission model requires the direct for us to integrate direct claim submissions to the Ministry of Health. And although we have suggestions for the billing codes, we don't have that integration built out yet, which is why I tried to show on the roadmap that once we have that integration built out, we would pivot to
Got
the
it.
commission model. But I'll definitely try to make that more clear on the first slide.
Okay, okay, that would I like that. And then even like maybe when you're talking about that, like don't show the old TAM, have like the new TAM pop up just so like that way the number that sticks in my head is like 60 billion or whatever it was, because 20 million is pretty small to justify. So like make sure like that's really highlighted. And then the other thing
Okay.
I'd say is like state your ask. Like you said, it was at the top of the slide, like 500,000, but like make sure you're saying like we're raising this amount.
Okay.
I don't think it was ever actually said. It was just like we're raising money to
Yeah.
like accelerate product. But
Okay.
that's yeah, those were all my comments. Like overall, like yeah, great job.
Oh, thank you.
All right, Melanie.
Hi. So yeah, I've seen yours before as well, Yoobin, and it was nice to see the evolution of it. You definitely kind of went more into the billing solution this time than the kind of AI scribe bit, um,
Mhm.
which is great. But at this point, like your product is an AI scribe, right? Like
Mhm.
you don't bill yet. So I do still think it's important to have some information on the fact that like that's
Mhm.
what people are actually getting, right?
Mhm.
If they're using your product, it is an AI scribe they're getting. Um, the just some little kind of things about the slides themselves. You had the slide with the competition with your kind of overlapping circles, and then you had your logo in between. Um, People might not recognize that as your logo yet, right? Because it's kind of new. So maybe just stick your name underneath the Q. You're so used to seeing your logo, but for me, I was kind of like, okay, where is Quip in here? Like, what are we looking at? And I was like, oh,
Right.
that's them. They're in the middle.
Uh-huh.
That little, the middle of the Venn diagram. They do both. Um,
That's a good point. Yes.
that's fine. Your slide, I think maybe it was slide 6, where you had your billing code there. Just
Mhm.
a little technicality. I think what you had was the diagnostic code for like a gastrointestinal
Mhm.
thing, but your actual billing code is probably like an A001 or an
A007. Yeah.
A003 or something
Yeah.
like that. Because yeah, you can't make
Yeah.
money off
Yeah.
the diagnostic code, and most people wouldn't get that, but
I was going to say that that's probably a fairly esoteric piece of knowledge.
it is very esoteric, but and yeah, no, but I do like the changes you had made. There was one slide where it was talking a lot kind of about the business model and the market, and you listed a ton of numbers that weren't actually on the slide. Like there was a lot of stuff that you talked about and listed numbers that weren't shown on the slide.
Oh, was this the part about the pharmacist by any chance?
No, is there one where the title is business model and market? I wrote that down.
Oh, I think maybe it was the MRR and the ARR numbers.
Yeah,
And
yeah.
then
There's like
okay.
a whole bunch of acronyms followed by a whole bunch of big numbers, but none of what you said out loud is actually shown on the slide. Those were
Yeah.
different numbers talking about different things.
Okay.
So maybe
Mhm.
put the stuff like the stuff you're talking about on the slide, just for people who like
Yes.
can't process the auditory information and actually need to read numbers to understand, or read acronyms
For sure.
numbers to understand what they mean. But again, just like a little technical point, because I missed that all because I can't process things that I hear very well. I'm a reader.
That's a good point.
Yeah, no, that's it.
Thank you
Great,
so much for the
thanks.
feedback. I remember hearing the advice both of you gave 2 weeks ago, so definitely tried to make the changes. But I guess now it's kind of swung too much in the other direction where it's too much focus on the billing instead of the AI scribe. So we'll try to clarify that.
And
for
yeah,
next
and I
week.
don't want to confuse you by like kind of going completely back, but I think there is like just a bit of a balance between like
Mhm.
what the product
Definitely.
actually is right now that people are
Mhm.
kind of using and buying, and the possibilities for the future and what your goals are there.
We'll definitely do that. Thank you both so much.
Thanks. And I'm going to add to that a little bit because so great pitch. I haven't seen your full pitch before, so thought you did a really good job. A couple of things, I guess related to the billing code. The billing code felt fairly OHIP centric. And then you talked about having customers in the rest of Canada and the US, and you never talked, and maybe it's because your main product is actually the scribe. But having seen the full deck for the first time, it left me unclear as to how you had US customers when it seemed to be a primarily OHIP integrated product. So I would do probably two things. One is how you're going to do billing codes outside of Ontario. And, to Melanie's point, a little bit more on the scribe portion, which presumably you can sell to anybody without having integrated with the codes in whatever their healthcare system is.
Right. Okay, so I guess to answer that point, it's exactly as you said, because the core functionality is the AI scribe. That's how we have US users using it. But the Canadian users can access like the suggested billing codes based on the note that the AI scribe created. But obviously that's not going to be applicable to any of the other users.
Yeah.
So
Yeah,
we'll
because it
clarify that.
Yeah, it sounded like the codes was a key feature. So I think you need to put a little bit more on how you're differentiated even on the scribe part, because that's explaining how you're getting into the US market.
Okay, for sure. We'll do that.
I thought on your competitive slide, I did recognize your logo. But what you said was you were bigger than what everybody else did, but the logo is sitting small and in the center, and it didn't visually scream out, hey, you do more than everybody else. Just the way this slide was. So you might want to think about how you do the visuals on that, so that at a glance, I think you do more, as opposed to, they do all of this, and you do this little bit in the middle, which is visually kind of looks.
Right. Yeah.
One way,
No, that makes sense. It's very tiny.
one way I've seen that done before is just like a 2x2 matrix. So you can kind of show the AI scribe functionality along one, and then the billing along the other, and put your guys's up in the top right corner. And then that way you can make the logo larger as well. That's like just a common way I've seen it shown.
Awesome. Yeah, I'll try to test it out with different visuals.
Yeah. That visual didn't scream to me that you did more than the others. All right. Any other last feedback or questions for Yoobin? All right, great job. And we've given you a couple minutes to transition over to your Ottawa hospital meeting.
Thank you so much. Really appreciate it. Have
All
a good
right.
one.
Bye.